Hello, Mrs. Scout. How are you today?
Good. How are you, Rachel?
Good. Are you ready for your appointment?
Yes, it's so nice to see you. You are my favorite.
All right, Mrs. Scout. Let's go ahead and update your health history today. I see that you are on Lipitor, and that is for your high blood pressure and cholesterol, correct?
Yes.
All right. Okay, so now we are just going to update your vitals and make sure that everything is in proper limits so we can give you.
My doctor tells me to watch what I eat because I'm kind of overweight.
Yeah, it's probably for the best. He knows.
I just can't help it. Did it look okay?
Well, your blood pressure is still a little bit high, but it's
I
not.
got a test.
It's because you had a test
Yeah,
today.
I'm kind of scared.
That's all right. It's a little bit high, but that doesn't mean that we can't give you treatment today. And so we will go ahead and continue.
Okay.
All right, so after taking your blood pressure, your respiration, and your pulse, everything is a little high. Your blood pressure was 137/88, which puts you in about a pre-hypertension range. So you don't quite have high blood pressure, but not have good blood pressure, which is why you're on your Lipitor. Your respiratory rate was 20, which is, it's okay. That's not too high. And then your pulse was 110, which is a little out of the normal range. And so maybe we can talk about doing some more exercises, maybe just getting out and walking 10 minutes every day.
Okay.
And that could help a little bit
Sometimes I do
with
it
your...
like 1 minute across campus.
Okay, that's good. Maybe make it 2 next time.
Okay.
All right, if I can just get your signature, be all set and ready to go. I'm gonna go have the instructor check this out, and I'll be right back.
Okay.
Miss Scout, how are you feeling today?
Good. How are you?
Good. Rachel, can I take you away to talk to you for just a second?
Yep, I'll be right back.
Miss Scout, we'll be right back.
All right.
Okay, so tell me about your patient.
She's a little overweight. She's taking Lipitor for her high blood pressure and cholesterol. Her blood pressure was a little bit high, 137/88.
Okay.
So we're still gonna go ahead with treatment today, but we're just gonna make sure that we keep an eye on it. Her pulse was also kind of high, and so just gonna keep that monitored.
Okay, does she have any history of anything we should be aware of, or?
Nope, just her high blood pressure and cholesterol.
Okay, perfect. All right, well, we can go ahead and proceed with your care plan. I see right now that you have, your care plan is for local anesthesia for route planning and scaling. So I'm gonna go ahead and watch and assist you, okay?
Okay, sounds great.
We are going to use the local anesthesia, like we talked about doing last time, to do some route planning.
Okay. You might feel a little bit of pinch or sting, but it should be quick and over before you know it.
Okay.
Are you ready?
Yes.
All right, I'm gonna go ahead and lay you back then.
Okay.
All right. So we're just gonna feel a quick little pinch.
Okay.
It'll be over before you know it. How was that?
That felt good. I didn't even feel anything.
Good. Perfect.
You're
Rachel,
good
that
at
looks
that.
really good. I'm gonna go ahead and go and let me know if you need anything. I'll be back to check on you in just a sec, okay?
Okay.
Are you okay, Miss Scout?
Yeah.
Okay, perfect.
You guys are so nice.
Okay, Mrs. Scow, we're gonna start. So let me know if you feel any areas of sensitivity or you're uncomfortable.
Okay. I don't really feel so good. I think I need to sit up.
Okay, let me sit you up. Is there anything else that's bothering you?
I just feel lightheaded. My jaw and my chest, it's kind of hurting, and it feels kind of hot, like I'm sweating.
Okay.
I don't really know.
All right. Have you ever had an adverse reaction to anesthesia before?
No, I don't like it.
You don't like it? All right.
I don't feel good.
Okay, I'm gonna go ahead and take your blood pressure and your pulse and your vitals again. Just make sure that everything's okay. Okay.
Just have never felt like this before.
Okay, we're gonna get you taken care of, all right?
What's going on?
All right, Mrs. Scout. Nothing to worry about.
You're so reassuring.
I do my best. Shelby, I need oxygen and 160 milligrams of aspirin. Jordan, I need you to call 911 and contact any family emergency number.
Okay, I'm on it.
All right.
It's all right, Mrs. Scout. We are going to get you taken
So
care of.
go ahead and administer this
All right,
160
I need you to
milligrams of
take this
aspirin.
aspirin for me.
Okay.
And then there's the
And we're going to
oxygen.
put on this oxygen mask to help you breathe, all right?
Okay.
I contacted the family and I called 911.
Okay, perfect. Yeah. All right, our patient is now unconscious. I'm going to lay her back. We're going to lay the chair back. All right. Okay. Shelby, I need you to go get me the AED.
Okay.
And I'm going to begin CPR.
All right.
Until EMS arrives. I'm starting CPR.
Here's the AD.
The EMS has just arrived.
Perfect. I can stop. Right?
Rachel, tell me why you did CPR instead of using the AED.
I made sure that I checked Courtney's pulse, Mrs. Scott's pulse, to make sure that it was still there. And since she did have a very faint pulse, I began CPR. If for some reason I put her pulse or I couldn't feel her pulse, I would have brought out the AED and done that.
Okay, very nice. So Jordan went with Courtney to the hospital.
Okay.
And so now I need you to tell me what you would document.
I would need to document the symptoms that the patient demonstrated. I would want to make sure that I documented all those updated vitals that I had done. I would need to document the treatment provided, the patient condition, the family members that were contacted, and I think that's about right.
Okay. So I just want to let you know that I'm really proud of the way that you handled the situation. Also, can you tell me what some prevention strategies for next time now that Mrs. Scout has experienced a heart attack?
I would need to make sure that I scheduled her for short morning appointments. We shouldn't see her for at least a month after this episode. I would need to make sure that I use a comfortable chair position, such as maybe having her sit up a little bit more. I would need to make sure taking record vitals. I would need to do like a stress reduction protocol. Just make sure that I'm really friendly to her, that we're using good communications, and I might even need to use like nitrous to help calm her down a little bit, or an oral sedative. She won't need any type of antibiotics for her care, and I'll just need to make sure that I limit the use of epinephrine, and definitely use caution with retraction cords with epi, but cardiac doses of LA with epi. Strategies would be to give her some adequate pain control medicine, avoid any anticholinergic. We will also have the myocardial infarction listed in red at the top of the health history, so that other hygienists and faculty are aware that she's had one of these.
Perfect. Those are really good prevention strategies. Can you think of any management strategies that should be implemented?
Well, we were able to act really fast. It was important to administer the aspirin and the 4 to 5 liters of oxygen, and to begin CPR right away as soon as she went unconscious. There are early thrombolytic therapies such as streptokinase, urokinase, altipase, and also early revascularization. We could have administered a calcium channel blocker or a beta-adrenergic blocker.
Very
That's the
nice.
management strategies.
So why do we need to know the prevention and management strategies?
We need to be prepared and aware of what is going on with our patients. If we know of medical problems they have, we can do things to prevent an emergency from happening. Like, for example, seeing someone in the morning time for shorter periods of time could prevent an emergency from occurring. It's also important to know the management strategies, because if the emergency does arise, we need to know how to best handle the situation from being catastrophic.
You've learned a lot, Rachel. Thanks for your quick reaction. Sweet Miss Scout will be back to her jolly self in no time.
Oh, that's a good thing. Sounds kind of scary. Here we go.
You're not
What
recording.
paddle did you have today?
Pilates.
Pilates? That's a cool one.
Miss Scout, how are you?
Good, how are you, Kathleen?
Good. So I see that you updated the health history and vitals. I'm just going to steal Rachel away and we're just going to talk for a second, okay?
Yeah, take it on.